Novita Indriawati. I'm from Polytechnic Katolik Mangunwijaya. I want to answer question from case study 17. Before I answer question from case study 17, I want read the case study 17 informed consent. Let's go. Mr. S, 56 years old, male, consoled his family physician due to respiratory problems. After X-ray revealed palsy infiltration of the lung, Mr. S was referred to a respiratory specialist, who determined that the condition was bilateral and recommended an open lung biopsy, which Mr. S refused to undergo. After Mr. S' condition further deteriorated, he was referred to Dr. D, an internist specializing in respiratory disease. Dr. D observed that Mr. S was exceptionally anxious upon examination. The doctor's initial diagnosis was progressive pulmonary fibrosis of the interstitial pneumonitis type. Probably involving fibrosing alveoli. A biopsy was required to confirm this diagnosis, but Mr. S continued to refuse to undergo an open lung biopsy. Dr. D then suggested an alternative procedure known as a drop-in lung biopsy. This procedure was inferior to the open lung method, but in view of Mr. S' refusal to undergo the open lung biopsy, it was an appropriate alternative. Dr. D explained to Mr. S that the procedure involved administering a local anesthetic and then inserting a special needle into the lung while the patient sat on the edge of his bed. They also told the patient the needle would be attached to a drill. Dr. D then outlined the procedure's risks, advising Mr. S that the procedure was usually virtually painless, but did have two possible complications. Dr. D did not mention to Mr. S that the procedure also involving risk of perforating the spleen or the liver, an uncommon risk but not as uncommon as death. Apparently, Dr. D was not aware of this risk. Mr. S consented in reading to the drop-in biopsy procedure. Prior to the procedure, Mr. S was anxious, apprehensive, and nervous. He told Dr. D he could not afford to die. He was given atropine and sedated with normal and accepted dose of morphine. Once Mr. S had been sedated, Dr. D gave him instruction and demonstrated the equipment to him. After a local anesthetic was administered, the operation began. At the critical juncture, Mr. S was directed to hold his breath, insert Mr. S veins, and move, causing his spleen to the perforated. Dr. D told Mr. S that the required tissue sample had not been obtained, but did not yet disclose that the spleen had been perforated. When Mr. S asked Dr. D what they had obtaining from the biopsy, he answered something else. It soon became painful, waves that Mr. S. plan had occurred and had to be surgically recommended. From the case, taking into consideration that Mr. S. was an extremely anxious patient, should the doctor have acted differently with respect to the explanation he gave to Mr. S? My answer is yes, because Dr. D should have acted differently than he did. The patient was inadequately prepared psychological for his required role in the procedure, since Mr. S was recognized as an unusually anxious person. Dr. D should have won Mr. S confidence through better and more effective communication. Dr. D gave instruction and demonstrated the equipment only after Mr. S had been seated. The procedure should have been explained and the equipment demonstrated when Mr. S was in an unsedated state. Furthermore, this particularly anxious patient should have been prepared for this procedure through careful rehearsal to teach him how to hold his breath and refrain from moving. The statement Mr. S made to Dr. D immediately before the procedure that he could not afford to die was a clear indication of this apprehension. At that point, Dr. D should have evaluated Mr. S' willingness to proceed, which could have been tested only when Mr. S was alert and not under sedation. This is my answer from case study 12. And thank you. Goodbye.